All right, we're here at the Cleveland Clinic Medical Innovation Summit here, and I found something interesting here from Milt Jackson. Milt, I see this some tasty stuff here on the table, and some stuff that doesn't look quite as tasty. What's going on?
Well, I've had a simple observation. I'm an internal medicine doctor, and the idea was simply that if people can't taste their food, they don't eat it. I've had many patients that cannot be forced to eat because they can't taste their food. Most of us have been there. Most of us had colds or sinus infections. There's also rat studies and trauma patients. People can't eat if they can't taste their food. So I had an epiphany. We need to put that together. We can make food tasteless, and we can do that briefly by, if we look at a model of the head, we can poison the olfactory nerve with a little alcohol, little phenol. The nerve is there, it dies. We can't taste, can't smell for about 6 months until it all regenerates. That is the kicker. That's the reason that we can lose weight, because we lose the sense of taste. There's no motivation to eat. Obese people eat tremendous amounts of food only because it tastes good. Most of us back off, only eat modest amounts, and that's not a problem. The problem is the only gain is the taste and the desire and the enjoyment of food that these people have. Well, we can get rid of that, and it's behavior modification. If you come down to it, people learn that they don't need to eat so much. It's not a cure, it's a treatment, but it's simple, it's dirt cheap, and it could be combined with these other modalities. Certainly, everybody does not need surgery, which is dangerous and expensive and has a lot of issues with it. This is just a simple idea, and guess what? There's nothing out there. There's very few new drugs on the market. The FDA can't push things through. There's not a lot of treatment out there for obese people. And guess what? We got something that's very simple that could help people.
So people who eat, for example, because they're stressed or bored or whatever, now you're saying because they'll still may want to eat because they're stressed, but they may eat better things because they're not looking for the taste of the junk food.
And they'd eat less.
And
most of us have had that. Again, most of us have had that sensation where you have a bad cold, you don't eat as much because it doesn't taste good. There's no motivation, there's no reinforcement, there's no secondary gain, there's no taste.
There's no taste at all, or just limited?
The tongue only appreciates sweet, sour, salt, and bitter. Our taste is actually a sense of smell. So this is just a very, very, very simple idea that would help people to quit eating so much. That's all it is.
It's amazing no one's thought of this before, because it is so basic, and like you say, we've all had that cold or something and lost taste and passed on the donuts or the cookies, and just had a little soup and we're satisfied.
Yes, sir. That's all it is.
So how do people find out more information about this?
Well, I'm a clinical doctor. I'm a hospitalist, and actually I've got 2 jobs. I can't do the business. I don't have the connections. I don't studies the marketing. So I'm here at this wonderful summit to hook up with somebody that can actually do that. I'm trying to pass this along.
Gotcha.
I'm not trying to do it. I'm trying to give it away. That's the whole beauty of this, because I realize that I'm over my head. I'm not a business person.
Yeah.
And I'm not a clinician, and I'm not a researcher. I'm trying to give this to somebody
do something
that
with,
can do something
so we
with
can get the caloric value from the rice cakes and not miss the taste of the cookies and all that.
That's exactly it. That's how wonderful it is. All these innovations here, well, guess what? They're all complicated, and most of it's related to surgery. This is just a very simple idea that is very marketable. People understand it.
All right. Thank you, Dr. Jackson.
Thank you.